When your child has epilepsy, we know your first goal is finding a way to control their seizures. So hearing the word surgery, well, it can feel pretty overwhelming, right? Today, we're just going to walk through what this option is all about and look at it as what it can be, a safe and hopeful path forward.
For so many kids, medications work wonders. They really do. But for some, the seizures they keep happening, even after trying the right treatments. If that sounds like your journey, I just want you to know you are absolutely not alone, and there are other paths we can explore.
And that's exactly where this conversation begins. When medication isn't giving us the control that we're all hoping for, it doesn't mean we've hit a dead end. Not at all. It just means it's time to start looking at other safe and effective options, and that includes epilepsy surgery.
Okay, let's start with the basics. What is epilepsy surgery? Put simply, it's a treatment that has one main goal: to reduce or, in a lot of cases, completely stop a child's seizures. It's a way of getting right to the source of the problem.
To get a picture of how it works, let's imagine the brain is like a big, bustling city with all these electrical pathways. A seizure can be like a little bit of trouble that starts in just one small neighborhood.
So what the surgery does is it focuses with incredible precision right on that one neighborhood. The idea is to either carefully remove that starting point or to just disconnect its pathways so that the seizure activity can't spread to the rest of the city. So when does surgery even come up in conversation? It's really important to know that this is not the first step. It's not even the second. It's a very carefully considered option that we only start talking about when the time is right.
We really only begin to discuss surgery when two things are happening. First, when you've already tried several different medications and they just haven't been able to stop the seizures. And second, when those seizures are clearly getting in the way of a child's quality of life. Their learning, their playing, their overall safety.
The approach is always thoughtful. I think this quote really says it best. It's a journey, not a race. The decision to even think about surgery is slow, it's methodical, and it's a partnership between your family and the medical team.
Long before any decision is made, we start a journey of really careful evaluation. You can think of it like we're creating this incredibly detailed map of your child's brain, just to make sure we know the absolute safest and best path to take.
Now, this evaluation involves a few key things. We use tools like an EEG to basically listen in on the brain's electrical activity. We use an MRI to get a really detailed picture of its structure. And we also use video monitoring to see exactly what happens during a seizure, which helps us connect all the dots.
All of this testing, all this work, it has one single crystal clear purpose: to find the exact spot where the seizures are beginning. That precision is everything. It's what makes sure that treatment can be as targeted and effective as it possibly can be.
And of course, your child's safety is the #1 priority through this whole thing. The evaluation is done by a specialized team that has tons of experience with kids. Your child is completely asleep under anesthesia, and they are watched closely every single second.
Okay, let's shift gears and talk about the most important part, the goal. What's this all for? The entire point of this whole journey is to open a door to a brighter, safer future for your child.
So what does that future look like? Well, the goals are pretty clear. Stop or at least drastically reduce the seizures. And when that happens, it helps improve your child's whole quality of life. It gives them the space to develop, to learn, and to grow more independent.
This image really captures that goal perfectly, doesn't it? Moving from a place of chaos and worry to one of clarity and potential. For so many children and their families, this can honestly be a life-changing step.
So what happens after the procedure? Well, the care and support for your child and for your whole family just keeps on going. The recovery period is a well-planned, supportive part of the journey.
Usually, your child will stay in the hospital for just a few days, so we can keep an eye on them while they heal. Then there will be follow-up visits, and of course, your team will still be there for you. A lot of kids do still take medication, but often at much lower doses, which is a big win.
If there's one thing I really want you to take away from all this, it's this right here. This is not some sudden, scary thing. It is a carefully planned journey, one where you're guided and supported by experts every single step of the way.
And so we'll just end with this question. It's not for us to answer, but for you to think about. By exploring all the safe options that are out there, what could that safer, brighter future really look like for your child and for your whole family?